Hello, and welcome to another Healing Hearts segment. It's that time of year again, and some say it's the most wonderful time of the year. However, for some, the cold winter months can bring on the blues, depression, and even seasonal affective disorder, which is a type of depression that occurs during the fall and winter months with symptoms of mood swings and fatigue. As a psychotherapist in private practice, clients often come in and ask me, am I depressed? I'm not sure if I'm depressed. Do I just have the blues? Everyone gets the blues, but for the blues, symptoms subside after 1 to 2 weeks. And then after those 1 to 2 weeks, you're starting to feel a little bit better. But if those symptoms persist after 2 weeks, it's important to get screened for depression. There's a lot of research about depression and what depression looks like, and many of my clients and adolescents alike understand the symptoms of depression. Many of us do. You can Google them and find them. And of course, that includes sadness, tearfulness, emptiness, some hopelessness. But there are some symptoms that sometimes surprise clients that they may be having that points to depression. The first one is anger outbursts. So, ever hear someone say, I'm going from 0 to 100? That's probably not a good sign. This may be a sign of depression. Anger outbursts can be dangerous, especially if they're unexpected. It's important if this symptom is showing up to get help so that you can learn how to manage your anger, find a mental health professional in your area to help get some support. Secondly is agitation, crankiness, you're less patient, nervousness, or an urge to move around without purpose. Those could be signs of agitation. Recent studies indicate that Black women specifically, their depression symptoms can show up differently. So it's really important to make sure that you're looking for some of these unique signs because they may point to depression. And lastly, food cravings. When depression kicks in, the serotonin levels decrease, and that can trigger cravings for carbohydrates and sweets. Instead of reaching for those carbs and sweets, so try healthier options or like natural sugar, because refined sugar does not help depression symptoms. It just kind of feeds that depression and it continues that cycle. So be very careful with that. So if you or someone you know is experiencing some of these symptoms coupled with some of those other traditional depression symptoms, don't hesitate to contact a mental health professional to get a proper assessment, diagnosis, and get some support. You can also call the 988 number, which is the suicide and crisis hotline number. It is available 24 hours a day, 7 days a week. You can call it anytime. So this holiday season, don't suffer alone in silence. Share this with your loved ones as well, and be sure to bring in the new year with love and support.